Start with some deep breaths, expanding through your ribs on your inhale, feeling your pelvic floor lift on your exhale. Not too big, gentle. Lift one knee up towards your chest on an exhale. Bring it back down. Repeat on the other side. Try to lift with your exhale, feeling your pelvic floor initiate before your knee actually starts moving up. Reach the opposite hand across so the palm hits the knee. Gently press knee into hand, hand into knee. Lightly, doesn't have to be a very strong push, just a gentle push to feel the resistance across your body, from rib to opposite hip. Slide the opposite leg down towards the floor and back up while you are pressing. Again, coordinate on the exhale. Press, slide the opposite heel down, press that back of the leg into the floor, slide the heel back up. Repeat on the other side. Press, slide back in, release. Cross one ankle over the opposite knee. Pull the knee inward. Reach the opposite hand across. Knee into hand, hand into knee. Gentle push. On an exhale, curl your tailbone up just a little bit off the floor and release. Push hand into knee, knee into hand. Curl tailbone up. Lift and down. Release. Knee into hand, hand into knee. Lift. Down. Repeat. Again, on the exhale is where you're pushing. Switch to the other side. Gentle push and lift. Gentle push, lift. Small lift off the ground. The push from your shoulder should be coming from underneath, closer towards your armpit than your neck. We're now going to go ahead, flip over onto all fours, wrists under shoulders, knees under hips, long spine. Start with the breath. Inhale, round. Exhale, lengthen. Look up. Inhale, expand your back. Round. Exhale, long spine. Inhale, round. Exhale, long spine. Inhale, exhale, tuck the toes under. On an exhale, you're going to go ahead and float your knees up. Push through your shoulders, knees lift, knees come back down. Exhale, shoulders, knees, down. On an exhale, shoulders engage. Knees lift up and down. And again. Flatten. Sit back into a child's pose. Take another deep breath. Expand through your back and relax. Inhale. Expand through your back. Exhale. Now to a kneeling position. Make sure you're tucked under, lifted in the front. Ribs are sitting right on top of your pelvis. Engage that back glute. Feel the front of your hip open. Reach that same side arm up and reach to the opposite side, opening through that same side. That hand reaches to the outside of your front knee. Look behind you. You can keep that arm in. Reach the same side arm up as the front leg. Opposite hand is going to reach down towards the floor. Head looks up towards top hand. Back up. Reach down. Eyes on the top hand. Back up. Make sure you're pulling your front leg back and your back leg front as you reach down. Switch sides. We're going to start with a tuck under. Feel the front lift. Feel the hip open. Reach to the opposite side. Hand to the outside of the front knee. You can open up that arm, or you can keep that elbow bent. Now we're going to reach the same side as the front leg up. That arm is up. Reach the opposite hand down towards the front foot and back up. Again, your front leg is pulling back. Your back knee is reaching forward. You're going to feel your hips squeezing together as you reach down. Switch legs. Reach that front leg out now. So the heel is digging in, toes are reaching up. There's still a slight bend in the front knee. You're going to hinge forward, keeping the spine long. Reach your tailbone out. Let your foot rest. Flex that front foot. Bring it back down to the ground. Stay long in your spine. Flex the foot. Toes down. Switch sides. Slight bend in the knee, flex the foot. Long spine, hinge over your waist. Toes come down and flex. Toes down. Up. And up. We're going to take a switch now. Still in a kneeling position, but now you're going to bring your front leg out to the side. Keep your pelvis lifted. Your knee is pointing in the corner, and you're going to lean into that front knee. Feel the hips open and back up. And again, bend into that front leg. Keep your pelvis upright. Switch sides. Pelvis lifted in the front. Your bottom leg should be rotated under slightly, so you should be able to see your heel on the inside. We're now going to switch to your back, heels out. Just take a few breaths. Feel your body just melt into the ground and all of your muscles relax.